Jhoanne and I will be presenting the Babinski Plantar Reflex.
Okay, very
It
good.
was discovered by this guy here, Joseph Babinski. Is a French and Polish neurologist who discovered it. It is a normal reflex in infants that occurs birth until 2 years old. When you stroke the sole of the foot, big toe raises out and the other toes fan out as well. You'll see a video of that in a minute. And if it's present after 2 years of age, that is a sign of CNS disorders. So here's a GIF of little baby feet. You see how the toe comes up and the other toes fan out. So this tests the integrity of the CST. It originates from the cerebral cortex through the brain and spinal cord. So the pathway of that is there's stimulation, then it goes to the Noki fibers, which are your pain receptors, to the tibial and sciatic nerve, the S1 region of the spine, and then to the anterior horns. So that's the stimulus going to the brain and then back. It goes from the Noki receptors inputs, spreads beyond the S1 anterior horn, which is not normal, indicating of damage to the CST. That goes to the L5 and L4 anterior horns of the cells, and that will cause them to fire. Then it'll contract the toes extensors. This is normal for babies because they have not yet fully myelinated their CST. So indications of this reflex happening after 2 years of age. You perform this as a normal routine exam. And if it does happen, it can mean that there's lesions of the CNS, or you are Lou Gehrig disease positive, or you have a brain tumor, injury, spinal cord injury, defect or tumor. Meningitis can cause this, viral infections of the brain, and multiple sclerosis, or it can be an indication of stroke or neurodegenerative diseases. So the technique is you make sure the patient is relaxed and comfortable. You use a dull instrument, not anything that's going to hurt them by any means. And you can run it up the lateral plantar side of the foot. And you can also perform this while the patient is asleep because it is a reflex. And it's important not to perform it on the foot if there are lesions, anything like that. But there's an alternative way that you can do that Jhoanne will tell us in a minute. So now I'll pass it on to Jhoanne.
Okay, so what happens if a patient tests positive for the Babinski reflex? Well, again, that's just a sign of a spinal cord injury that could be due to trauma or a sign of a central nervous system disorder. So what happens? The doctor is going to go ahead and order some testing just to help diagnose whether it's an injury and an injury location or whether it's a disease. So to do this, they'll go ahead and perform a CT scan or an LP, which is a lumbar puncture, or do an MRI. And from there, for treatment, they can do interventional radiology. So that's the picture depicted on the bottom. There could be anything from radiation, oncology, or needle biopsies. Other forms of treatment for central nervous system disorders would be something pharmaceutical, stimulation of the deep brain or spinal cord, rehab, and surgery. So in our next slide, the clinical significance. So as Becca mentioned, the examiner is going to watch for the upward movement of the big toe and fanning of the other toes, which would be Babinski positive. Now, if there is no reflex, or if the toes deviate downward, then that'll be Babinski absent. If there's no movement, no reflex, then that's a neutral response. So there's no real clinical significance. So if they need to test Babinski reflexes, they can also do that in comatose patients. So patients that are in a coma. For these patients, they'll show a triple flexion response. So that's basically when the thigh, the leg, and the foot has some sort of flexion and dorsiflexion. And that is a profound significance of the CST. So in our next slide, you'll see an example of what a triple flexion response does. So basically what she said there is triple flexion response refers to a dorsiflexion of the toe and ankle and flexion at the hip and knee joint. And then from there, something to take note of that Jacinda covered is you have to be able to distinguish whether it's a triple flexion or a withdrawal response. So like Jacinda said, pulling away from heat. However, in this case, it'll be pulling away from feeling ticklish. So that's something to take note of, just the difference between triple flexion and withdrawal. And in our next slide, we're going to be covering enhancing healthcare team outcomes. Nope, the one back. Okay, perfect. So if the patient is missing a toe or if they have an infection on the bottom of the foot, healthcare workers can use other methods of the Babinski reflex. The closest thing would be the Hoffman reflex, and that occurs in the upper extremity of the body. And in our next slide, you'll see an example being performed on the fingertips. So there you'll see as he flicks her fingertips, she's gonna have some sort of reflex on the top of her hand and some sort of slight jerking. Okay, and our next slide is our references. Any questions?
Questions?
I actually have a quick question for the Hoffman reflex.
Oh.
Wait, so your fingers are supposed, maybe I missed it, but they're supposed to do what?
So when
They're supposed to flick?
Yeah, when they flick on the fingertip, you'll have some sort of reaction at the some sort of very similar to a knee-jerk reaction, but it occurs at the top.
Something happened with, I cannot hear anything. Something happened. There are several microphones that are on, I believe. Okay, you are the only one that had to be on. Please explain again. I didn't understand anything. Jhoanne?
Hi, Raquel, did you get that?
No, okay.
Okay. So Raquel was just wanting some clarification on the Hoffman side. So basically the examiner is going to go ahead and flick the fingertips, and similar to the knee jerk movement talked about earlier, when they flick the fingertip, they're going to have slight jerking movements at the top of the hand and even to the wrist. So it'll be like, it's very slight.
Show it again. It's good you show again. Yeah, the video.
It's okay, Raquel.
Can you see now?
Right on this other arm, it's stronger of a reflex.
Mm-hmm. Can you see it? You see?
Right there at the wrist.
You see it, Raquel?
She says yes.
She says yes.
Ah, okay.
Okay.
Okay. First, Jhoanne, you mentioned meningitis in one of the first slides. Rebecca mentioned that. What is meningitis, Jhoanne?
Oh my God. So itis refers to inflammation, but it's inflammation of the nerves.
Huh? Again?
The meninges.
Ah, inflammation of the meninges.
Yes, I got it wrong on my quiz. So
Yeah, no, don't say anything. Only I want you to feel sure about what is meningitis and explain to everybody what is meningitis. Meningitis is an inflammation, of course, but it's an inflammation of the meninges. Yeah?
Yes.
And how do we call the inflammation of the neurons?
Neuritis.
Neuritis. Very good. Very good. So you learn that. Okay, now show me your first slide.